This is Green Street, the Environmental Health Show, greenstreetnews.org, Patti and Doug Wood, and our worldwide network of health professionals, researchers, authors, reporters, and others here every week to keep you up to date on what's happening in the world and what you need to know to keep yourself and your family safe and healthy. Welcome back. There's probably no greater influence on your health than what you put into your body. Today on Green Street, we'll be talking about the nexus of food and health with someone who's on the front lines of what seems like a real revolution in the way we think about food and using food as medicine. That's coming up in just a few minutes here on Green Street, but first, some of the news of the week. Patti, what's going on this week in the world of environmental health?
Well, this one is a little bit disturbing, but a group of community health and environmental groups is suing the Trump administration to stop an executive action that would exempt 50 of the country's most toxic chemical manufacturing plants from meeting government standards that guard against the emission of hazardous, cancer-causing air pollutants, including ethylene oxide and chloroprene.
Ethylene oxide is really dangerous.
Yeah, we've talked about that quite a few times.
Yeah.
Critics say the administration's unlawful and unprecedented use of these exemptions puts the health of communities in 13 states in jeopardy.
I bet they're all states in the in the South, in that belt of states where they have all these factories.
Cancer Alley?
Yeah.
Probably some of them for sure.
Yeah.
Anna Paris, co-director of Texas Environmental Justice Advocacy Services, said, quote, "Community leaders in this movement have fought for protections like this for more than 30 years. We remember family, friends, and neighbors who we lost as a result of highly hazardous pollutants. It is our collective responsibility to ensure consistent and continuous enforcement of federal laws and protections for our communities," end quote.
Man, oh man.
EPA has estimated the updated protections would reduce air-related cancer risks near these facilities by approximately 96%.
A 96% reduction in the risk.
That's exactly right.
And now they're going to let the companies put all that stuff back into the air.
Absolutely.
Wow.
So that's what's happening at the EPA. They're basically undoing regulations that were put in place to save lives.
You know, Patti, these people have worked for, not just these people, but literally thousands of people have worked so hard for years to try to achieve these kinds of
30 years is a long time.
Basic protections for people who live in these fence-lined communities.
And these regulations, these restrictions would reduce the cancer risk by 96%. That's huge.
And what's the deal? It's going to save the companies a little bit of money? I mean, they can do it, right? I mean, technically they can do it.
We are not making the right choices here.
You think?
Yeah.
Wow.
It's very upsetting. It's very upsetting.
What else you got?
Well, do you know what Vibrio vulnificus is?
No.
I'm going to guess you don't. Okay. Well, you probably should, because it's a flesh-eating bacteria that is now found in our coastal waters. The bacteria used to be found mostly in the bayous of Louisiana, but scientists now are connecting the rising number of cases of Vibrio poisoning to climate change, which is warming oceans, raising sea levels, and lowering salinity, conditions that help the bacteria spread.
Oh, boy.
The bacteria has now been found in the waters of North Carolina, New York, and Massachusetts.
Wow.
Yeah.
Okay.
Vibrio can infect people through opened wounds exposed to contaminated water or by consuming raw or undercooked shellfish, especially oysters. Severe cases can cause sepsis, require amputation, or become fatal in just a matter of days.
So they're finding this bacteria in the waters off of New York and Massachusetts?
As far as protecting yourself, health experts emphasize that you should avoid exposing any cuts that you may have on your body to coastal waters. Wash wounds thoroughly if you are exposed, and seek medical help immediately if any of these symptoms appear. And that would include redness, swelling, pain, fluid oozing, and in severe cases, chills, large blood-filled blisters, and sepsis.
Holy cow.
Holy crow.
Who knows about this?
I don't know. I've never heard of it.
No.
I've absolutely never heard of it. But is it a surprise? No, because we're seeing a huge increase in blue-green algae, which is also a bacteria.
Yeah.
And it has, some pretty serious symptoms associated with it as well. This will come back now that it's here, now that it has established itself.
Sure.
And I'm sure that it will spread. Global warming is here to stay.
All right. Thanks,
Okay.
Patti.
All right. You're welcome.
The Good News Show.
Yeah.
Thanks.
We are missing out on a big part of life if we don't cook. To cook is to live. So writes the author and TV food personality Christina Perello. And she's right. After all, you are what you eat, and when it comes to your health, you're only as healthy as what you eat. So today, as more and more people get their calories from ultra-processed foods, there's a growing movement among health professionals, clinicians, researchers, and policymakers to recognize the transformative power of nutritious food as medicine and the importance of real food education across all sectors of the population. Today on Green Street, we're delighted to welcome Katie Welch, Executive Director of the nonprofit Teaching Kitchen Collaborative, based in Boston. Doug and I spoke with Katie the other day about the organization and its leading role in the food as medicine revolution. Here's our conversation with Katie Welch.
The Teaching Kitchen Collaborative is a global membership organization for institutions and professionals that are using teaching kitchens to teach future doctors, patients, and community members about what to eat, how to think and move our bodies in order to have resiliency and health throughout a lifetime. So our collaborative is about 75 members strong at this point. And these are hospitals and universities, community-based organizations. We have museums, big corporations like Google are members of the TKC. And they all come together to really share best practices, collaborate, do research projects around this innovative new field, which is hands-on culinary medicine and behavior change through learning about cooking, eating, nutrition, etc.
So let me ask you a quick question. You did mention these are in part for medical students and doctors to learn about proper nutrition. Do you actually look at particular illnesses like chronic, illnesses that people have, chronic disease, and specifically what to eat for a chronic condition?
Yeah, absolutely. A lot of our members do that. That is their work and their day-to-day work within hospital systems. Boston Medical Center, for example, has a beautiful teaching kitchen where they are teaching current patients within specific disease categories or who, suffer from chronic conditions, how to eat to treat their specific condition or health concern. BMC is also doing an amazing program right now for folks who are in addiction treatment. So how does that sort of show up in a teaching kitchen and in this collaborative learning environment?
So, Kate, is this happening because of research that's going on at Harvard, at TH Chan, about the relationship between certain kinds of foods and health outcomes?
That's a great question. I mean, the TH Chan is sort of the leading voice in nutrition at this point. And the Teaching Kitchen Collaborative was actually created out of a collaborative work project between the Chan School of Public Health and the Culinary Institute of America. So these two institutions had come together before. They have a really successful conference called Healthy Kitchens, Healthy Lives. And really they're teaching doctors, like, here's what you didn't learn in medical school and what you need to know about nutrition. So that was really the impetus behind the creation of the Teaching Kitchen Collaborative. And we're now hitting our 10th year. We're seeing today just unbelievable interest and requests for membership within our collaborative because everybody is moving towards this idea of food as medicine being an integral and foundational part of healthcare. So, we're seeing it from the right, we're seeing it from the left. It's not a political question. It is something that is fundamental to the health of all Americans.
This is so interesting. I mean, there were some early pioneers in this. There is a book written by Henry Byler, who was a Harvard professor, an MD, who wrote the book, Food is Your Best Medicine. Really, really an important book. But even more so than ever, the food that we eat has an environmental component to it. Whether it's plastic or whether it's processed foods, do you actually talk about the different types of food that we are exposed to today that we would consider an environmental exposure as well when you do your work?
Yeah, great question. There's a lot of environmental and sustainability conversations within our collaborative and in the work that all of our members do. We generally say what's good for you is also good for the planet. right? So you're not looking to eat things that put a large burden on our earth and on our natural resources. That's a lot of what is in the new Eat Lancet report and what was in the original report, how our eating really impacts the environment from production of that food, all the way through its life cycle within the food system and human consumption. So I think it is so important to consider the environmental impact of what folks are eating. But I think also you need to meet people where they are. So if there is, a food desert, or we're calling it a food swamp now, which would be a place without any fresh fruits and vegetables, fresh food for people to take advantage of, and they're surrounded by bodegas or shops where there's only ultra processed foods. That's what we consider sort of like a food swamp. What are the opportunities for those folks to, get on a bus or, take a train to another place where they have access to that fresh food? So we really need to meet people where they are in terms of their own food journey. And we try to ensure that there isn't a lot of shame around what food people are eating. There's a lot of conversations within our network now about not encouraging people to eat the right food versus the wrong food. It's just more of what is good for you and good for the planet, and not sort of, restricting the diet of folks who come through our kitchens.
You talk about these food swamps. I mean, what's the solution to that? Are you actually reaching out to community colleges that are located in these food swamps or food deserts and trying to figure out a way for them to have access?
So the collaborative is not. Our organization is responsive to the members that we already have and the applicants who are coming in. I will tell you, with our recent applicant pool, the NIH is looking to join the collaborative. We have a huge number of members who find us, and we're not actively or proactively going out to seek new membership. However, we do provide a lot of resources for communities. So whether they're schools or, federally qualified health centers or hospitals that may serve these communities that are in these food swamps, they all have access to TKC resources. So we have free webinars that are essentially professional development toolkits. So Ultimate Teaching Kitchen Toolkit is a great resource and great way for folks to get started thinking about how they might put a teaching kitchen into their institution. But we are not actively going out and prescribing anything for our teaching kitchens or for, the culinary medicine or teaching kitchen programs that exist out there and outside of our network.
Food is such a personal thing. I mean, I know people really don't like to be told what to eat. People are making all these different choices.
Very intimate relationship. Just incredibly intimate relationship. What you eat every single day. I mean, you have certain preferences
and habits. So do you get pushback from people about what they eat? How do you navigate that?
It is each clinician navigating that with each individual person. We laugh a lot of times and say, if you've seen one teaching kitchen, you've seen one teaching kitchen, right? They're all so different, and they're all based on the needs of the population that they're serving. There's recently a study that came out, it was published by the Tufts Food is Medicine Institute just this month in October, that looks at what are the barriers to healthy eating for people. Number one is cost. That is far and away the most, the most predictable factor when it comes to eating healthy. Number two is family traditions. So that speaks volumes to what you were saying about food being so core and fundamental to who people are, what their families are, their ethnicity, their traditions, their background, and it's so intimately woven into the fabric of lives. So how do, future doctors or nurses or clinicians talk to people about their relationship to food? And, we're just starting to explore that in the research. Food ethnographers, people who take this sort of food history for a living, a physician or a pediatrician is not going to have an hour to sit down with someone to really understand their relationship to food. But with each sort of publication and now this movement from, nationwide, really predicated on, the impetus from the federal mandate, the MAHA mandate, that all medical schools teach nutrition, right? Everybody is moving in this direction. And so we're part of trying to find the solution of what can it look like? What should those conversations look like? And, I really am of the opinion that we don't wait for something perfect. We get started now and iterate as we go, because the problem is now. The problem was 20 years ago. The problem was 40 years ago when we started, thinking about what is convenient, what is fast, what can I do with very little effort. And we lost a lot of the sort of cooking and basic nutrition skills that are passed down from generation to generation, right?
Yeah.
Right.
We lost that learning from your grandmother or your grandmother's grandmother or your mother or your father or, some other community member who really wrapped around you as a kid. We lost that in generations, just in the last 2 generations of people learning how to cook in their own homes, to cook sort of healthy foods. We know if you're cooking at home, you're not going to be cooking the same way and with the same sort of relatively unhealthy ingredients that you would get at a fast food place or at ultra processed foods, at a store. You're going to be cooking in a healthier way. And we just want to help people to identify even healthier ways to cook at home, ways that they can eat foods that really support their health and well-being. And then also, we love to have this wraparound model where we're talking to folks about how they move their bodies, how they think, because really we feel like all of those pieces are fundamental and critical to overall health and well-being. So if we can impact all of those, that would be the ideal scenario. But truly a teaching kitchen where folks come together in a cohort to learn and do hands-on cooking, they share a meal together, that's almost as powerful as, the intervention itself, is having that moment together where you're sharing this sort of common meal and conversation. That is where we see true behavior change happen for people. And that's really what we're talking about. It's not like, oh, I swapped out, my chips for carrot sticks, which, we love and definitely do that. But it's not just that. It is this idea of fundamentally changing your relationship to food. And that happens in person. So there's a lot of money right now being thrown into food as medicine interventions, from medically tailored meals to produce prescriptions. And these are absolutely essential to our continued sort of understanding of health and wellness. You come home from the hospital and suddenly every day or every couple of days, there's healthy meals delivered to your door. That is absolutely going to aid in your recovery and healing from whatever you were dealing with in the hospital. That being said, when those meals stop arriving to your house, you don't have any more information or skills or motivation truly to eat healthy and be healthier. And if you don't have the information that you need, you don't have those basic culinary skills. And, in some cases, folks don't even have access to a kitchen. How do you sort of build that basic support around folks? And we do that in a teaching kitchen.
You talked a little bit about produce prescriptions. Can you talk a little bit more about that? Because I think that that's a new idea to many of our listeners, new concept.
Yep.
It's a new concept to everybody. It's new. It's new across the board. That's why,
tell us about it.
So a produce prescription is essentially when a healthcare provider or a insurance company, I can tell you CMS in California, so Medicare and Medicaid in California, is looking at this right now. And they're saying, okay, what are the populations that would benefit the most from having access to fresh fruits and vegetables? And then they can partner with essentially what it is an agricultural business that can take produce from many places, congregate it into one, and then they are producing boxes like that would arrive from Amazon on your doorstep. They're providing boxes of fresh fruits and vegetables that are delivered to your doorstep with a nice ice pack, with a great branding. It looks like Blue Apron or, something else, anything that would be delivered to your house. And it is fresh fruits and vegetables, right? That is just an unbelievable opportunity to have access to that.
Sure.
There is a study being done with the Veterans Administration in 2 sites in Salt Lake City and down in UT Houston. They're taking veterans who have specific conditions and they are opting into this study where they're receiving a $100 HelloFresh card. And so the balance on it, goes to $100 once a month. They get $100 a month to spend on fresh fruits and vegetables. It can't buy anything else. And so these veterans are going to the grocery store and they have access to this money. Now, not all of them are using all of the money. Not all of them know what to do with the produce when they get it home. I will say a couple of factors that, are showing increased usage. I love this. One is being married. If you're married, I think your spouse is like, you need to eat that, go buy those carrots. Again, I really like those. There are some flaws in this study. Like, we don't really know when that produce goes home, who's consuming it within the home. But we are going to be able to look at those veterans and their health conditions during this time period to see the impact there. So, those studies that are being funded, again, this one is from Rockefeller, those will help to unlock some important keys for the food as medicine movement. What is really the impact of providing folks with fresh fruits and vegetables? Are they using them? Are they doing the work that's required to prepare and get them all ready? And then, that sort of leads to this idea that everything is based on this idea of how do we reduce healthcare costs, right? What does it look like to reduce healthcare costs? So can you track time in a teaching kitchen or a produce prescription or whatever the food as medicine intervention is to real world data? And that is emergency room visits, ambulatory services, primary care visits. Can you tie it to any one of these external data points? And you can show over time, and this is what we hope to do, is show over time that there's a real impact in overall health and wellness through this sort of, array of food as medicine interventions.
I just think this is fabulous. And we're going in the right direction. I just have to tell you this personal story. So we are a CSA, Community Supported Agriculture drop-off point, and there's a new driver. And then today, when he dropped it off, he said, I get a box of the vegetables that I'm delivering as part of my pay, right? It's what I get. He says, and I brought it home and we all fixed those vegetables and ate them, in some cases for the very first time in our lives. And they were delicious. We'd never tasted anything like that. So that's just a personal story of somebody being exposed to something that they'd never been exposed to and decided, this is really delicious. It makes me feel good.
There is definitely a key element here, but I will share a story with you, which is that during the pandemic, when we had a lot of money and subsidies flowing into food banks to provide just basic food access, there was a library here that was giving people bags of food. And around the corner was a trash can where everybody dumped their rutabagas because it was a weird looking vegetable and they didn't know what to do with it. And so
I should have been there. I would have just emptied the trash can. My favorite root vegetable is rutabagas. Holy smoke. Okay.
I listen, exposure is one thing, but then education is really essential.
Sure.
Right? How do you make it easy for people who have never seen that vegetable before to cook it, eat it, enjoy it in a way that they feel competent in doing so again? And so, if you just provide something, I don't think that anybody's throwing out a pint of raspberries if they get that in their produce prescription box. That's a win across the board. But for some vegetables that are more unusual, I think you do need to provide some sort of education for folks on how do you handle that vegetable, what's the best way to prepare it, how do you make it delicious. Being a product of the Culinary Institute of America, making the food taste good is really essential to having people want it.
Yeah, absolutely.
Right? And so, that is something that is just.
I always cringe when people take the beet tops off their beets and throw them in the garbage or leave them in the box when they finish taking everything out of their CSA box. It's like, why aren't you eating those beet tops? They're the best green ever, but they've never had them before. And you're right, education is everything.
Kate, can you talk a little bit about the role of ultra-processed food? We read a news article the other day that said that Americans were getting 60% of their calories from ultra-processed food. That's got to have an impact on their health.
In terms of ultra-processed foods, we are not prescriptive with our members. Again, they have to meet patients or community members or doctors where they are. And so we don't put out, curricula or, mandates that say, as a member of the Teaching Kitchen Collaborative, here's our stance on ultra-processed foods. I think it's common knowledge among all of our providers that we are trying to move away from folks eating those ultra-processed foods. They're not good for you. But there's also a lot of controversy around, what does constitute an ultra-processed food? What are those ingredients that make it really what we would consider like not a healthy food versus things that are something we might let pass through because they are not necessarily impacting the nutritional value or, impacting the health of the eater. So, it's a complicated topic. We really believe that our members are the best people to talk to their community, to talk to their students about what it means to eat for them. I was down in Texas recently, and we are conducting currently a multi-site research trial on a co-created teaching kitchen curriculum for folks who are pre-diabetic. It's happening at University of Texas in Houston, UCLA, UC Irvine, and Dartmouth-Hitchcock up in Vermont. And it was piloted up at Dartmouth-Hitchcock during the pandemic. So we piloted it there, and now we're pushing it out to 4 sites. And we have some preliminary data, which is really promising. But the last time I was down in Texas, my friends at UT Houston said, we don't eat garbanzo beans. Like, what are these chickpeas, right? It's something that's so common in Vermont, we wouldn't even think about it, or in California, but in Texas, it was an unfamiliar food. And so I think, just understanding the differences in this country in terms of what people eat, what they're exposed to, what they're comfortable with, that's a really good example of why we consider our members the experts in what they teach and in the communities that they're in. And we're not here to prescribe, like, you should definitely do this or stay away from this. We're here to bring our community together, to learn from each other and share best practices.
So, Kate, are you optimistic about where we're headed in terms of food and medicine in this country?
I am. I'm incredibly optimistic about teaching kitchens becoming an essential part of healthcare and routine healthcare for folks. I think we've come so far down this path of eating quick and convenient ultra-processed foods, and we're essentially paying the price with our health right now. You can see the bottom line being impacted with healthcare organizations, hospitals, and Americans are paying, if not at the grocer, at the doctor's office for this, this reliance on unhealthy foods. It is absolutely essential, and we see this growing movement of professionals, administrators, policymakers, lawmakers really leaning in to supporting food as medicine, supporting the agriculture that really supports it on the back end, supporting the health of our planet through what people eat. And, I am really optimistic, especially with this administration's focus on accelerating a national shift towards this prevention-focused healthcare. I think there's a lot of good things that are ahead of us here within our small niche of the world. And I'm just so thrilled to be part of leading our collaborative on this national and global stage.
Katie Welch, Executive Director of the Teaching Kitchen Collaborative, a network of thought-leading organizations that leverage teaching kitchen facilities to enhance public and planetary health. You can learn more about Katie and the TKC at the organization's website, teachingkitchens.org. That's going to do it for our show this week. Please remember you can always hear our show and links to all our news items on our program website, greenstreetnews.org. Special thanks to Katie Welch for being our guest and to all of you who listen to and support this show. Patti and I will be back next week with another edition of Green Street. Thanks for listening.